What is Parkinson's disease?
Parkinson's disease is a disorder that affects the brain and causes problems with movement. It happens when certain cells in the brain stop working properly or die. These cells make a special chemical called dopamine, which helps control how we move our muscles.
Because of this, people with Parkinson's may have symptoms like shaking or tremors, slow movements, stiff muscles, trouble with balance and walking. Parkinson's usually develops slowly and mostly affects older adults. Scientists are still learning about what causes it and how to best treat it. Causes of Parkinson's disease: loss of dopamine-producing cells. In Parkinson's, certain brain cells in an area called the substantia nigra gradually die. These cells produce dopamine, a chemical messenger, neurotransmitter, that helps control smooth and coordinated movement. Genetics and environment: some genes increase risk, and exposure to toxins might also damage these brain cells. Age: older adults are more likely to experience this loss of dopamine cells. How Parkinson's affects the nervous system. The nervous system structure and function. The nervous system is made up of the brain, spinal cord, and nerves. It controls everything your body does, from moving muscles to feeling sensations and thinking. Brain cells, neurons, communicate with each other using chemicals called neurotransmitters like dopamine to send signals. The substantia nigra in the brain is part of the basal ganglia, a group of brain regions that help control movement. What happens in Parkinson's? When dopamine-producing neurons in the substantia nigra die, less dopamine is available. Without enough dopamine, signals from the brain about how to move muscles become weaker or mixed up. Because of this, people have trouble controlling movements. Muscles can become stiff, slow, or shaky.
Parkinson's disease damages brain cells that produce dopamine, a chemical needed for smooth movement. This causes the nervous system to send mixed signals, leading to shaking, stiffness, and slow movements. Treatments for Parkinson's disease. Medications. The most common treatment is medicine that increases dopamine or mimics its effects, like levodopa. These help improve movement and reduce symptoms. Side effects. Medicines can cause nausea, dizziness, or involuntary movements after long use. Deep brain stimulation, DBS, a surgical treatment where small electrodes are placed in the brain to help control movement. Side effects. Surgery can have risks like infection, or temporary problems with balance or speech. Physical therapy helps improve strength, balance, and flexibility to make movement easier. Cures. Currently, there is no cure for Parkinson's disease, but treatments can help manage symptoms and improve quality of life. Preventative measures. There is no guaranteed way to prevent Parkinson's, but a healthy lifestyle might lower risk. Regular exercise. Eating a balanced diet with lots of fruits and veggies. Avoiding toxins like pesticides when possible.
Parkinson's disease affects the stimulus response pathway by damaging brain cells that produce dopamine, which helps send clear movement signals. As a result, when the brain receives a stimulus, the response signals to muscles can be slower or mixed up. This causes movements to be delayed, shaky, or stiff instead of quick and smooth.